Good afternoon, everybody. Here today with Dr. Brent Roussin, and thank you, Brent, for all your work and for that of your team. We appreciate it very, very much. First off, I just wanted to say a couple of thank yous, if I could, to all the students, the teachers, the parents, administrators who have been in remote learning for the past couple of weeks. I know that comes as a former teacher. I know that comes with a lot of extra work, and I just want to say to everybody, I know that your friends will be looking forward to seeing you back in school next week. Given the weather in the last couple of days, I just thought it might be appropriate also to say a special thank you to our highway crews. Been out there working their tails off for the past 48 hours and trying to keep us safe. A lot of cars in the ditch in the last couple of days, but that safety matters. And safety matters too when it comes to healthcare. And again, back to thanking Dr. Roussin and his team, because they deserve that thanks as they direct our efforts in the next phase of this pandemic. On Wednesday, Health Minister Heather Stephenson and I had the opportunity to tour Manitoba's second COVID-19 vaccination super site in Brandon's Keystone Centre. That site's going to open its doors on Monday, January the 18th, and it'll be ready to vaccinate over 4,000 priority healthcare workers in its first week of operations, with a planned capacity to immunize many, many more Manitobans as additional vaccines become available. Our plan to immunize all eligible personal care home residents by mid-February is also now underway, and at this time we've had close to 280 personal care home residents vaccinated, and that's welcome news, I know, for them and for their loved ones and for all of us who care deeply about our seniors. This is a significant step forward. These are significant steps forward in our commitment to reach as many Manitobans as safely as possible with life-saving vaccine. We're dedicated to getting it right first. We'll get it fast later, but we want to make sure that we're doing it properly, and that's the progress that we've made, is making sure that that's happening. I'd like to pass it over to Dr. Roussin now to provide today's COVID-19 update, share with you what our plans are for the coming weeks. Over to you, Brent.
Thanks, Premier. Good afternoon. Today we're announcing 5 additional deaths due to COVID-19. One individual from Northern Health Region, one from Southern Health Santé Sud, and 3 from the Winnipeg Health Region. I'd like to extend my condolences to their families and friends, loved ones, caregivers. Our current 5-day COVID-19 test positivity rate is 10% provincially, 7.2% in Winnipeg. As of 9:30 a.m. today, 191 new cases of the virus have been identified, bringing our total lab-confirmed cases in Manitoba to 27,145. Well, our test positivity rates, case numbers, hospitalizations are starting to come down. This is allowing us to begin the slow process of ramping up elective surgeries. Every day, more and more eligible Manitobans are getting the COVID-19 vaccine, and this is bringing hope with it. The actions and hard work by Manitobans is making a difference, and we see that continue to make that difference. We looked back at our modeling numbers, some that we shared to you, the trajectory that we were on in early November. And looking back at that, we have figured that from November 12th to January 3rd, these level red restrictions have likely saved approximately 1,700 lives. These are estimations and certainly has a range to that. But based on the trajectory that we are at and what we saw the results of these restrictions on, we feel a good estimate is about 1,700 lives saved. The restrictions are quite tough, but it's obvious they've made a difference and continue to make that difference. We lost many Manitobans, and our hearts go out to those families. But we can see from our restrictions we've saved many more. This virus does not discriminate. And certainly our lives cannot return to normal at this point. We're not out of the woods, and we have a long way to go before we can get back to a normal pre-COVID level. We know it's been hard and it's been weeks But we can do this, and we need to do this, and we are doing it. If we let up on now, all this hard work and sacrifice from these past several weeks will be for nothing. We could get back to where we looked at in early November. We need to keep going in order to bring our numbers down and continue to reduce that strain on our healthcare system. We'll consider ways to carefully reopen Manitoba. We must always consider the needs of our healthcare system and limit the activities that we know cause the greatest risk. We need to remain vigilant, focus on those fundamentals, including staying home when you're ill, wearing masks, washing your hands, and physically distancing to reduce the risk of the virus, staying home and self-isolating if you're waiting for test results. If a person in a household is ill, we are asking the entire household to isolate pending results of that test. We need to continue to focus on these fundamentals, protect ourselves, the people around us, our communities, our loved ones. We need to continue to make these sacrifices in the short term so we can have a safe long term. We know in general the overall risk comes with the more close contacts we have. And those fundamentals strive to reduce the amount of close contacts we have outside of our household. I wanted to remind Manitobans that text messages will now be used as part of to support case and contact monitoring on a daily basis. This is in addition to phone calls from contact tracers and automated phone numbers calls. This will alert Manitobans that their test results are available on the Manitoba COVID-19 online result display. It will provide recipients with an opportunity to confirm their isolation status, report changes in their symptoms, and request direct contact from a contact tracer. Text messages are being provided as an additional service to augment the contact tracing that the team's already performing. That's now just another way public health officials interact with Manitobans. And similar to a phone call, it's important that public respond to these text messages as soon as possible to improve the speed and accuracy of our efforts to contact trace. Finally, Manitobans are reminded that other provinces have enacted restrictions to reduce the spread of COVID-19. So while traveling for non-essential reasons is strongly discouraged, if you have to travel, be sure to check for any restrictions at your destination and follow self-isolation rules when you return. Ontario Public Health has introduced new regulations indicating that individuals can only travel to another residence or cottage for less than 24 hours for essential business. Longer stays may result in 14 days of isolation in Ontario. So thanks again to all Manitobans for your hard work. I'm going to pass it back to the Premier.
Thanks very much, Dr. Roussin. Our number one priority, and I say our, I don't just mean Brent and I mean all Manitobans, thinking, caring Manitobans, our number one priority in the face of this pandemic is to protect our most vulnerable citizens and to ensure that our healthcare system is going to be there for all of us when we need it, during this pandemic and well after this pandemic as well. The best thing we can do for our healthcare system, for our schools, for our vulnerable communities, for our local businesses, for our friends, our family, for our loved ones, is to make sure that we keep bending that COVID curve down, and we keep it down. Our current public health orders that have been in place for over 2 months now were put in place at the advice of Dr. Roussin and our medical experts, our public health leaders, in order to halt the spread of this deadly virus and to save lives. And as Dr. Roussin's just referenced, they are working and they are saving lives. The reason they're working is because of you, because of your willingness to follow those rules. And they will only continue to work with your willingness to follow those rules, with your cooperation, with your dedication to following those rules. But Manitobans deserve to be proud. According to Stats Canada, compared to every other jurisdiction outside of Atlantic Canada, Manitoba is the only province that's bent the COVID curve down. And that trend has continued over the past few weeks. Manitoba's 7-day moving average, according to Stats Canada's most recent numbers, Canada's average week over week is up 14.5%, British Columbia up 11.5%, Ontario is up 28%, Saskatchewan's up 59%, Quebec's up 10%. Manitoba is down 18.7%. That's you. That's you doing the right things, and that's saving lives. So I just encourage all Manitobans to remember that because of you, there is a real reason for optimism with that progress. And now with the development and the deployment of vaccines, and they'll be slow in coming, and remember that 9 out of 10 Manitobans won't have a vaccine by the end of March. That's the estimated delivery of the federal government's orders. So because of that, we cannot let our guard down, which is why we will continue to take a cautious approach to reopening our communities and restarting our economy. Our goal is to move forward, and our goal is most certainly to create a sustainable path forward where our businesses can safely reopen and stay open. What we don't want to do is have a yo-yo effect where we allow openings and then, because of rising case numbers, have to then invoke more restrictions. That would not be in anyone's best interests. So today, we're here to ask for your input to help inform our next steps. We have continued to consider the input of Manitobans an important part of this exercise from the very beginning, and we've had over 300,000 interventions from Manitobans into our Engage MB website since the beginning of this pandemic. We value your input and appreciate it very much. There are a number of services and activities that could be considered, but we must remember that this can't be and this won't be a fast return to normal. From the very beginning of this pandemic, we've reached out to you directly to ask for your ideas. I'm doing that again now. We want to ask you, and we want to hear from you on what is most important to you for your health and well-being, for that of your loved ones, as we move forward through this pandemic. So we've developed a questionnaire that I'm encouraging you to take a look at and to fill out. I encourage all Manitobans to go to Engage MB and fill out that survey and give us your views. That feedback is important and backed by the evidence and advice that is chief to our decision-making that Brent and his medical experts will provide. We hope to be in a position early next week to inform Manitobans of our planned path forward. We recognize the significant sacrifices all Manitobans have made in the face of this pandemic, particularly those who have lost a loved one. Over 700 Manitobans have lost their lives to COVID, and their families and friends are sorrowful and deeply affected by that directly. All of us are sorrowful for that reality. But when Brent alludes to saving lives and talks of 1,700 lives that potentially could have been saved by these restrictions, you understand how important your role is in this. It's essential. As we look ahead to the next few weeks and months, there is reason for hope. But we have to earn that hope. As I've said before, we've got duty in front of us, and 75 more days of duty for sure. So remember, we can't lose sight of the gains we've made. We can't sacrifice those important gains. We have to remain vigilant in this crucial time in our fight against COVID-19. We're not out of the woods yet. We have to follow those fundamentals. Stay home. Only leave home for essential purposes. Stay home when you're ill. Stay home if any member of your family is sick. Don't socialize with people outside of your household. Wash your hands, cover your cough, practice physical distancing. Remember, physical distancing matters. And wear a mask, too. Thank you. Look forward to your questions.
Thank you, Mr. Premier. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from CBC Radio Canada, Gavin.
Hi, Gavin from Radio Canada. A question for you, Dr. Roussin, about vaccination in care homes. It's Friday, and according to the update, there are 281 residents who have been vaccinated this week. Last week, the province said it intended to vaccinate over 1,100 residents this week. I was wondering if you could tell us what happened there.
Yeah, so I think we'll have further updates to those numbers. From what I'm hearing, the rollout is going very smooth in these facilities, and we're going to continue to update Manitobans. But by as early as next week, I think we're going to be providing some more up-to-date numbers to show just how well these things are rolling right now.
Dr. Roussin, how would you characterize the increase of cases in the north? Are you considering, stricter restrictions there, different restrictions, what's sort of the sources and ongoing vectors of transmission in the Northern Health region?
It's definitely a concern. We're seeing high test positivity rates. We're seeing cases in some First Nation communities and other remote communities. And so we knew that if the virus is in remote communities, there's much more risk for transmission. And so we'll continue to follow. There's a lot of work being done by the communities, by our rapid response teams. There's a lot of work to ensure alternate accommodations are available. And so it's certainly a concern from a public health view, and we know that the restrictions are still required in those areas, so we'll continue to follow that and continue to update Manitobans.
From CBC Manitoba, Bart.
Hi, Dr. Roussin. On that note, is it a foregone conclusion at this point that red restrictions will have to remain for northern Manitoba, given the trajectory they're on?
We haven't made any final decisions yet on those, on the upcoming review of the orders. And so, definitely nothing's off the table. Definitely we need to take that approach that's going to protect Manitobans, and so we've never removed the more regional approach that we've done in the past. So it's definitely on the table.
All right then, Mr. Premier, in the last year when restrictions were removed gradually, you and Dr. Roussin came out with proposed ideas and then asked for feedback. This time, not floating any ideas, but just asking for feedback. Why the change?
Well, we're going to float ideas early next week, Bart, and follow the same practice we've been following all along.
From the Canadian Press, Steve.
Good afternoon. Dr. Roussin, given what we've learned about how the virus is transmitted, what can you tell us about the risk of reopening businesses, non-essential businesses or larger capacity, versus lifting the restrictions on in-home visits and socializing indoors?
Yeah, and so, this virus we know spreads through interactions, especially in closed spaces, crowded places, is where we see most of the transmission. And so the more we interact, the more close contacts we have, the more spread we see. And so you could see in our, in our restrictions we had in October and end of October or very early November, we still had very significant restrictions, but we're still seeing that trajectory of growth. And it's just as simple as that the more people interact, the more we're going to see this virus spread. And so in-home transmission certainly takes place, especially through close contacts of cases. And again, if we have people gathering in large numbers in residences, we're going to see transmission. And so we need to, as we move forward very cautiously, we need to ensure we're balancing the need for people to have some interaction with the risk of interacting in large groups.
And to follow up to either one of you who wants to answer this, given that the data that we saw in the fall about it continuing when businesses were being largely shut down and socializing remained until early November, is it not less risky now to reopen non-essential businesses and loosen the restrictions on the business side versus loosening the restrictions on the socializing side?
I think it's fair assertion. There'll be in the questionnaire that you'll have a chance to view. Actually, Steve, there's a bit of educational material and background material further to your observations that is part of which is in there. I think the idea here is to give the public a chance to share with us what they feel is something they value, their priorities, at the same time and putting it in the context of a greater understanding of why the restrictions are brought in the first place and what goes into designing them. I think this is an important exercise because, again, what's happening in many other jurisdictions across the country is a function, in part, of people not being willing or able choosing not to be able to follow the restrictions themselves. And we want to make sure that the public has a chance to participate in the framing, have some input, because it's public buy-in that is in large part responsible for our ability to make the progress we've made, and will be responsible for any progress that we continue to make as we move forward.
From CTV Winnipeg, Jeff.
Hi, Mr. Premier. I just want to clarify something that Bart asked you earlier. So is the plan here to release the survey, get results by next week, and then float the ideas before the end of the public health order for further feedback? Is that what I'm hearing?
Exactly right. The plan is to float our recommendations earlier in the week next week, give the public a chance to have a look at them. If they impact on people, then people should have a chance to see what they are, so they can make sure that they're abiding by those changes if there are changes recommended by Dr. Roussin.
Thank you. And my next question is for Dr. Roussin. Given national modeling from the Public Health Agency of Canada shows Manitoba has the highest rate of hospitalization per capita, is it wise to consider easing public health restrictions at this point?
Yeah, and so, it's based on our trajectory right now that we're seeing. We're seeing those hospital numbers gradually come down, certainly not as fast as we want. But our test positivity is improving, our overall case numbers are improving, and the strain on the healthcare system, while still present, is improving. So I think we always need to take the least restrictive means. We always have to hear and engage Manitobans to hear where they are, and that's what we're doing. And any loosening that we do does have to be very cautious and slow. So we'll be taking that all into consideration, watching these numbers closely, but you can be assured that our approach is going to be a very cautious one.
From City News, Mike.
Good afternoon, Dr. Roussin and Premier Pallister. My question, earlier in this you referenced, Dr. Roussin, if we let up now, all the hard work and sacrifice will be for nothing. There was a protest yesterday outside of Bell MTS where there was no social distancing and no mask use, about over a dozen people, and there's another protest planned for tomorrow outside of City Hall. Do you have any words to these protests, and will there be any enforcement seen?
So, I would say that the right to protest is certainly there. I would suggest that people who are protesting ensure they're following the public health orders. So keeping those group sizes down, wearing masks if possible, and just being careful in that regard. But I think that it should be clear that these restrictions are very difficult for people, but they work. We see the trajectory that we had in the beginning of November and where we were predicting we would be at the beginning of December. And we implement these restrictions and we see those numbers coming down. We see now, just in these past couple of weeks, being able to return to elective surgery. And so there's no doubt that we all hear how difficult these restrictions are, but it should be clear to see why they're in place, why they needed to be in place, and why, as we might be in a bit of a position now to loosen them very gradually and very cautiously, we're not out of the woods.
And my follow-up, can you just explain a little bit of the math of how you measure the trajectory of how many deaths we would have seen had there not been restrictions put in place?
Yeah, and so this was really a retrospective analysis. We had those modeling numbers with the amount of cases that we would expect to see on that worst case scenario, because that was the trajectory we were at when we put the level red restrictions on. And so from that, we would predict how many cases we would have had up until January 3rd, and extrapolated largely to the case fatality rate that we're currently seeing. And of course, just like our modeling numbers, we see a large range of possibilities there. But in the in the center of that range is about 1,700 deaths.
From CHVN, Taylor.
Hi, good afternoon. Dr. Roussin, I see that you're looking for feedback when it comes to gatherings for both household and religious. What would be reasonable for people to expect when it comes to these reopenings? I'm guessing next Sunday churches won't be at 100% capacity?
Yeah, so I mean, to expect is we're going to be very cautious. We have to be very cautious on our approach and very slow approach watching these numbers because, we see transmission around us. We see still a strain on our healthcare system. So we haven't made any final decisions. So we truly are looking for feedback from Manitobans. But Manitobans can expect a very cautious approach moving forward.
And how is the province balancing the need to prevent the spread of COVID-19 with other health effects that come from the lockdown, such as mental health effects or surgeries being postponed?
Well, I mean, it's this is part of the challenge, right? Finding that balance. We know there's immediate health effects not only to people who acquire COVID-19, but to those who are in need of health care for other reasons. And so the best way to limit the impacts on elective surgery delay is to bring our COVID-19 numbers down so we can get back to elective surgeries. So those are very tightly linked. As far as mental health, there's a number of resources that are available. We want people to still reach out to their healthcare providers. There's in-person, there's virtual visits that are available for that. And so certainly there's effects both ways on this, but we've always been trying to find that balance.
Thank you.
And say to you, Taylor, and through you to Manitobans, that it's pretty hard to feel depressed when you're feeling thankful. And I would understand that people have made sacrifices very, very much, but I also understand that those sacrifices are paying off in terms of saving lives. And so if you can give yourself credit for being part of that, you'll feel pretty grateful. And I know a lot of other people will too. And if you can feel grateful, then you can do this. We can get through this. We're talking about cautiously reopening, but we're always going to be bearing in mind the impact that this has on our health system and that it has on real people in our province. But as Dr. Roussin has said, we've saved hundreds and hundreds of lives, we, Manitobans, by abiding with these regulations. These recommendations are not there for any other reason but to protect people. So we need to continue to do that, and I hope if we can all take some pride in the fact that we've done the right things here to save lives, then that's going to help us for the next few weeks as we get through this together.
From the Winnipeg Free Press, Carol.
Hi, Premier. We've learned that Treasury Board Secretary Paul Beauregard is stepping down from his post as soon as his replacement is found. But he will continue to play a role on the Manitoba Vaccination Implementation Task Force. Will he be doing so as a civil servant, or will he do so as a high-priced consultant?
Carol, actually, we need our best people fighting COVID, and right now that's our number one challenge, and Paul Beauregard is one of our very best people. So he'll continue to be a leader in the challenge we now face.
And, Premier, community leaders in Thompson said they were caught off guard by your government's plan to locate a vaccination super site at the airport that's 10 kilometers outside the city with no public transit service available. The mayor said the plan wouldn't work for most Thompson residents, and the first that she heard of it was on January 6th when you talked about it at a press conference. Does this demonstrate top-down planning, and is it how we can expect the vaccine rollout for the rest of the province?
No, it demonstrates the Free Press's tendency to highlight hiccups in an important effort that we're undertaking as a province, which is historic in nature, which is saving thousands of lives.
From Global News, Marnie.
Good afternoon, Dr. Roussin and Mr. Premier. Just kind of following up on the Thompson question, when it does start, then the vaccination site there does start up, for people that might have to drive a long way, like, say, elderly people that can't sit in a car for several hours, will there be additional kind of housing or accommodations set up to accommodate people in that situation?
Well, I think I'll let the vaccine task force provide, specifics on things like this. A lot of work has been done in the planning, and remember that the planning is very difficult due to the nature of these vaccines. They're very hard to store. And so, it's not a simple task to plan these sites. So I'll let the Vaccine Task Force respond to specifics.
Okay, and in regards to the survey, last spring we did something similar, got public feedback, opened back up, and then we saw eventually this large second wave. Given everything we've learned since then, why do survey and consultations instead of relying on advice of public health?
Well, we do rely on the advice of public health, and we'll constantly do that, and that is, of course, the chief motivation for our construction of the restrictions that we have. But we can't ignore the reality that Manitobans have to abide by those restrictions, and so asking Manitobans their views is what we've done throughout this whole process. We've had over 300,000 participants engage with our government in this process, and we think that that's helped us, and most certainly it's helped Manitobans to better understand and accept the nature of the restrictions that affect them so profoundly. So we're going to continue to engage with Manitobans as we believe that is a helpful way to go, and a helpful way to make sure that we bend the COVID curve together, because we're all in this together.
From the Brandon Sun, Michelle.
Good afternoon. For my first question, I'd like to follow up on a small business question I asked of the Premier on Wednesday, and also following up on the work done by CBC earlier this week, where they quote the Retail Council of Canada. So between November 1 and December 15, data showed retail stores were connected to just under 3% of total COVID-19 cases. And they quote Prairie Director of Government Relations, John Graham, saying retail stores, frankly most businesses, create a safe environment, and in jurisdictions where they remained open, they haven't sacrificed the economy the way that Manitoba has done. So that being said, how does that 3% compare to the percentage prior to the shutdown? And in your estimation, is there a way forward that can include retail businesses reopening safely in spite of the ongoing pandemic?
Well, I don't think anyone who comes from small business, as I do, or who is related to or is friends with people in small business, fails to recognize the sacrifices that small business people have made in our province. At the same time, they also recognize that our programs in support of this bridge period and getting through it are among the most generous in the country of Canada. So we're doing the best we can to assist in making sure that our small businesses can get through these challenges, but we can't fail to also understand that when we travel, COVID goes with us. And when our contact numbers are higher, COVID multiplies rapidly, and that's what's happened in other jurisdictions. And so we're trying to make sure that we balance the necessary restrictions on people's lives in order to achieve the result, which we are achieving now, of bending the COVID curve.
Does Dr. Roussin want to weigh in on that one?
Yeah, I think that if you look at the trajectory that we had in November and put in these restrictions, you can see that these restrictions have been quite effective. I do think that in retail settings where we have capacity restrictions, then there is the ability to reduce that risk, and so that is something that we're looking at. We're going to be getting feedback on it, and then we'll have more to say next week.
Okay, thank you. My second question is actually a reader's question. It seems that positivity numbers are falling, though they still remain 2 to 3 times the 3% rate that Dr. Roussin described previously as concerning. But the number of tests being done has also fallen. If more tests are being done, will we be finding more cases and thus be getting ahead of the curve instead of just trailing after it?
Yeah, so it depends. Asymptomatic testing, we've shown time and time again that it has a limited benefit on a grand scale. There's certain times where it can be very targeted and benefit, but we see asymptomatic testing is less likely to find positive cases. And we see our test positivity rates here in this second wave remaining fairly high, although dropping, and it's dropping with their stable number of tests, so it is telling us what the trajectory is. But we just see in this second wave, we're just not seeing many other respiratory viruses. This time of year we see RSV, we see influenza, and we're just not seeing any viruses circulate. So right now, if somebody's ill and they have respiratory symptoms, it's very likely to be COVID. And that's why our test positivity rate remains high, because there's just not many other things out there making people ill. So we are going to follow that over time. There are times for asymptomatic testing, but we do have to ensure we're using our resources effectively.
From CJOB, Merrick.
Hey there, Dr. Roussin. Former Premier Pallister. We've heard reports today over the last few days of complications, difficulties with the Pfizer vaccine. How or will this affect Manitoba?
I'll start, Brent, by just saying I think this backs up our strategy. Our vaccination team has focused on not a little less on trying to get good short-term stats by rushing everything out, and a little more on better long-term protections by holding something back, and they've done that. They've also adhered to the manufacturer's recommendations in terms of scheduling the second vaccine within the prescribed time limit and not delaying the second vaccine so that they can spread it out more. If you don't want to see more people injected less effectively, and you want to see more vaccine strategies, that's what you're seeing with our vaccination team. One of the motivations for us holding some back is that we have been concerned about potential disruptions in the supply chain. Now that's happened, and I think this gives support to the Manitoba vaccination team strategy, which is to make sure, as best we can, that we're able to deliver that second vaccine when it's most effectively delivered, as the manufacturers have recommended. So we're following the National Advisory Committee on Immunizations guidelines where others are not, and we frankly believe that's the right approach, and I think that this sad disruption in the Pfizer delivery schedule gives verification to the good planning that our people have been doing.
Thanks. And just one more for Dr. Roussin. Has there ever been any instance here in Manitoba where someone has contracted COVID-19 twice?
Yeah, we're not aware of any reinfection cases here in Manitoba.
From the Winnipeg Sun, Scott.
Hi, good afternoon to both of you. Scott Bill at Winnipeg Sun. Premier, I'm going to go back to Carol's question because I don't think you answered it. I guess what are especially residents of Thompson supposed to think then if, the mayor is saying that they didn't hear about it till a week ago, and they're expressing concerns. You're not worried about it. It appears. I guess what are they supposed to think then?
Well, I think that they should think that they're getting an access center. One of 3 communities in the province that will get a super site, which is pretty good. There's a lot of other communities that would be really happy to have one in their area. And I think that the vaccination team can answer the questions about the location very well and has the capability to do that and has done that. So you're citing an old quote from the mayor, but I believe the mayor's been contacted and other officials have as well about the rationale, which is very logical and eminently defensible for why the super site's going to be located where it's going to be located.
All right, thanks for that. In your preamble, you noted the rising numbers in the East and in the West, and how the provinces here has our numbers have dropped. There's still travel restrictions to one side of the province, but not to the other. I guess I'm trying to understand, and maybe Dr. Roussin can answer this. If the epidemiology looks bad on both sides, why is there only restrictions on one side?
Our travel restrictions to the east are largely a remnant from our first opening strategies. As we were set to lift all of our self-isolation requirements in August, there was a very rapid upswing in cases out east, and as part of our process that we're similar to what we're doing now, engaging Manitobans, there was a very negative response to further opening, loosening those requirements. So they've always been in place, and so we continue to look, to the west, to the east, and see if there is any indications for further self-isolation requirements. We've had the requirements certainly for international travel, led both by the federal government, but also our recommendations on returning international travelers to be tested upon entry into Manitoba, and again at 7 days. And then we'll be engaging Manitobans again, and part of that engagement will include questions regarding travel restrictions and self-isolation requirements.
From the Globe and Mail, Shannon.
Good afternoon. My first question is for Dr. Roussin, and I believe it's been touched on a bit, but I'd like to revisit it. I'm wondering if it's possible, and I mean this in the epidemiological sense, to quantify the impact closing small businesses offering non-essential services has had on flattening the curve in Manitoba. Is there any way to quantify that?
It's really a really difficult thing to quantify. What we can do is look at our incremental approach. Right, so we've always taken that least restrictive approach. So we tried messaging, we've tried orange restrictions, and then we went into a section of red. And then with those restrictions, we still saw too many interactions. Too many cases, our trajectory is bad, and we needed to make that change. And one of the things we heard at that time was that despite having capacity limitations, despite listing certain retail businesses as essential, we're still seeing crowding occurring in those places. We are hearing concerns from small businesses that some of the big box stores were having a advantage because they were listed as essential but could sell non-essential things. So we put that in place. For one was the dire trajectory that we were on. We needed to make a change. We needed to have people staying at home, not doing non-essential shopping, and it worked. You can see where our numbers are. So what specific contribution, what that contributed to it, very difficult to measure, but we can see from the change in trajectory, it did have a contribution.
Thank you. My second question then builds on that. Just with the types of businesses that are reopening, we've seen that massage is back. You can have a tattoo removed, but you can't have one applied or use a service like a tanning salon. What goes into deciding which personal services are safe? What will be behind that thought as reopening does happen?
So the approach will always be a cautious one. When you mention a few of the examples that you're talking about, one is regulated health professionals. We weren't going to get into a list of procedures they perform and start listing what they can and can't do. They're regulated health professionals, so we'll let the regulators regulate. So that's why we haven't regulated, say, physicians there. We allow the College of Physicians and Surgeons to regulate physicians. And then we opened up to, allied healthcare professionals that were regulated. And then we included, registered massage therapists in that too. And so as we continue to open things, we'll look at further allied health professionals. But we felt the cautious approach was to open up to regulated health professionals who are self-regulatory, who manage things. And then we'll continue a cautious approach to try to broaden that.
Sure. Thank you very much.
From CBC National News, Cameron. From CBC National News, Cameron. From the Steinbach Carillon, Josh.
Hi, since both of you are available, I'd like for you to explain how decisions about restrictions are made. Does Dr. Roussin, sort of on behalf of public health, make recommendations about what should be done, and then does the Premier ultimately have the final call?
Despite efforts to the contrary, there is no light between Dr. Roussin and I today or any other day. I'm responsible for the decisions that are taken. We take the advice of our health experts. We've done that from the beginning, and we're going to continue to do that. But we also appreciate the input of Manitobans too, and that's part of what we're announcing today is the opportunity for Manitobans to weigh in on the prioritization, because I know Dr. Roussin as well as I are very interested in the input that Manitobans will provide, and we think that's critically important as we go forward.
Okay. I'm interested also in the necessary conditions to get rid of restrictions for good. Would an extended period of low case counts and, say, half the population getting vaccinated, would those two things warrant the end of restrictions?
It's tough to speculate on the exact things, right? So you mentioned a number of things. Of course, the epidemiology here is going to play a big role, vaccine coverage, and the more we learn about vaccine effectiveness. And then, of course, what's also relevant is the, transmission in other places, transmission in other places in Canada or U.S. or internationally. So there's a number of factors that are going that will go into consideration. So, we're going to be having some sort of restrictions for the foreseeable future, but the work we're doing now, the hope that the vaccine brings, does bring that optimism that we're there will be an end to this pandemic, but right now we need to stay focused.
So just to wind it up again, thanks, Dr. Roussin, for your work and your presence here today, and always. The saving of lives is what this is all about, and I would just say to those who are adamant that they've reached the end of their rope, I just want to encourage you. I know a number of small business owners, and I have many contacts with people across the province who are needing some motivation right now, I think, to get through this thing. And I'm reminded of a phrase that, being a child of the baby boom, post-Second World War, there was a common question asked, what did you do during the war, Daddy or Mummy? And what did you do during the war? And I think one of the things that we need to think about is what the answer to that question will be. And I think to Manitobans in the future, when you're asked, what did you do during the war on COVID, I think you deserve to think very strongly about this and ask yourself if you're going to be able to answer that question. I saved lives, honestly. I think for most Manitobans you can answer it that way. And I think if you abide by the restrictions that you will be able to say you saved lives during this war. So treasure that thought and remember that thought as we move forward, because we're not out of this yet. We're going to be cautious here, because this vaccine is not the cavalry coming over the hill right now. It's going to take time to roll out. It's going to take time to get into the arms of Manitobans. So some of the changes we're going to have to make on an ongoing basis are the changes that Brent and I have been talking about from the get-go. These aren't restrictions, but they're changes in habit. Stay home when you're sick. Perhaps we need to remember that beyond this pandemic. Don't socialize with people outside of your household. Hopefully we can start doing that at some point in the not-too-distant future. But when we do it, remember to wash your hands and cover your cough. These are things habits. They're habits that people have adopted. And because of that, I don't know if we have a flu case in this province right now, Brent. Have we had a report yet? One flu case. Okay, so we're doing things differently now than we did before, and probably we should continue to remember those things as we go forward, because they're healthy things to do. And to remember, I've seen more people out walking and enjoying Manitoba's outdoors, perhaps than I've ever seen during this pandemic. Those are healthy habits, healthy things for us to continue to do. So we're not going to get our old lives back. We'll get better lives back. Thank you.